So we recommend children to see an orthodontist at age of 7 is because that's when they normally have a mixed dentition, meaning that they have a mixed baby teeth and permanent teeth, and they have their front permanent teeth on the top and bottom, and they have their first permanent molars. So this is the age that we normally recommend children to see their orthodontist around age of 7 and older. Some of the problems that an orthodontist can catch versus parents might not be able to see it or notice it is crowding or not having enough space. A lot of times parents do recognize crowding when it's very crowded, but some minor crowding parents don't notice it, or if they have a bite problems, like a lot of times parents don't really notice the cross bite, which is when the molars in the back are not aligned correctly. So when we show it to them, they're like, oh, okay, I see that, and I can see the bite is not right. Or when the jaw growth is an issue, we can bring it up to the parents, or thumb sucking or any of the habits, and the parents do understand that their child is a thumb sucker, or but they don't know how much it can affect their teeth, or if they're a mouth breather, and that can affect their mouth and their teeth. A visiting to an orthodontist at the age of 7 does not mean that they're definitely going to get braces. It's just a checkup, and parents can talk to the orthodontist. The orthodontist can explain if the treatment needs to be done as soon as possible, or they can wait. So visiting an orthodontist does not mean at age of 7 they're going to start their braces right away. So children who go to the orthodontist early on, the orthodontist can address if they have any bite issues. And if it's fixed early on, it can prevent a lot of complications in the future. Or they can talk about reducing the underbite or crossbite. And also they're confident. A lot of times these children might be suffering for going to school, and they have maybe an overbite, and it's really affecting their confidence, and addressing that early on, it can really help their confidence. And a lot of times when we start the orthodontic treatment early on, it can reduce the time of the treatment versus waiting and treating them when they're older. I can say that when child's front teeth are protruding, they're meaning that they are more out, and child can be playing sports or even riding a bike. They can fall and they can break those teeth that don't have a lip support anymore because they're protruding. Or if they have crooked teeth, just like simply, when you see your child has some crooked teeth, or the teeth are not coming out in the right direction. Sometimes parents have noticed that the bottom front teeth are permanent teeth are coming behind the baby teeth, and that's a sign that the baby teeth are not falling out on time, so the teeth are not coming in the right place. They can bring the patient to the dentist, we can talk to them, we can send them to the orthodontist. A lot of times an underbite, those are the things that parents can pay attention to. Or just habits, simple habits of thumb sucking, or a mouth breathing, or chewing habits. Those are the things that if parents can notice them, they can bring them to the orthodontist, and they can be addressed early on. So what happens during the first appointment or first orthodontic appointment is that they have a consultation with the orthodontist. At our office, the consultation is complimentary. So they can see their options, they can talk to orthodontists, and they can ask questions, and the orthodontist can go over what the issue is, how they can approach it, what are the different options. So there's a lot going on in the first appointment. They can get their x-rays done, and the dentist can take pictures, or the dentist can take pictures, and they can sit down and figure out what would be the best treatment option for their children. Patient to orthodontist is when we notice some overbite or overjet, keep protruding. There is a problem in the facial growth in the jaw, or we see crowding. Or we see some teeth missing. Sometimes patients are missing permanent teeth. And so we refer them to ortho to discuss their different options.